Hi everybody, it's Dr. Jessie from the Healing Collective. I'm here in Phoenix, Arizona at the Frequency Specific Microcurrent Advanced Seminar, and I am tuning in live this morning because yesterday was such a full day. I just didn't quite have it in me to do a live video last night after all we learned about fibromyalgia. The course yesterday, fibromyalgia course, was over 8 hours long, and so in the evening I just digested the information and tried to distill it down for you all today so that I can just give you like my top 3 takeaways from the course. Number 0, if you're a healthcare provider and you're looking for a way to help people that have fibromyalgia that actually helps them, take an FSM course and take the fibromyalgia training. It's going to change the way you can practice. So anyway, back to the top 3. Okay, this was a lot of information, so I'm just trying to make it like as streamlined as possible. The first point is fibromyalgia is a neuroendocrine disorder. It's not in your head. It's not something that you just need to tough through and get over. There's a clear pathway that explains fibromyalgia, and it has to do with neurotransmitters, DHA, cortisol, branch chain amino acids, and human growth hormone. And it's not simple, and it's not easy. Like I said, we spent 8 hours yesterday learning about fibro, but we have a scientific basis and understanding for what it is. And Dr. McMakin presented a clear approach to the differential diagnosis of fibromyalgia, and she outlines a systematic way to differentiate between types of fibromyalgia, which makes it so much more approachable from a healthcare provider perspective. Okay, this person, this is the pathway we need to go forward and help them recover. So it's essential to differentiate fibro from other possibly similar looking or appearing conditions, including chronic fatigue syndrome, myofascial pain syndrome. It's not the same. Depression, hypothyroidism. A lot of patients with fibro appear to be hypothyroid, but then when you test their levels, they're not. Sleep apnea. This is huge. It's a whole other topic entirely. I could do a whole other live post, but in lieu of that, read the book The Promise of Sleep by Dr. Dement, and stay tuned because I think I will end up going into sleep apnea. It's such an important condition to understand. You need to also differentiate fibromyalgia from inflammatory muscle disease, Lyme disease, Parkinson's disease, polymyalgia rheumatica, rheumatoid arthritis, scleroderma, breast implant illness, and stay tuned if you're interested in that topic because we're going to roll something out of our office in the near future that addresses breast implant illness, the Healing Collective office. Lupus, Ehlers-Danlos syndrome, which is also treatable with FSM, candida. And so to differentiate between all of these things in fibromyalgia, you need to get blood work done. If you're a person with fibro, I want you to know that finding a functional medicine provider will get you far clearer results because that paradigm knows how to investigate the root cause. There is a root cause of your fibro, and someone who's trained to look for it is going to find it for you. Okay, so number 2, there are 9 distinct types of fibromyalgia that Dr. McMakin outlined for us yesterday. FSM, frequency-specific microcurrent, can treat all of them. And the most straightforward treatment is that of fibromyalgia from cervical trauma. So Dr. McMakin also published a paper in 2004 on this, and it can be found on her website, so you can look at the literature and the statistics on how FSM helps people with fibro from cervical trauma. And you can find that on frequencyspecific.com. I will link to it below in the comments of this video. So the types of fibro that we can differentiate are fibro from cervical trauma, fibro from prolonged stress, because remember, fibromyalgia is a neuroendocrine response, fibro from food allergies, fibro from toxicity, like mold, parasites, etc., heavy metals, fibro from immune system dysfunction or a viral infection, fibro from someone who's progesterone deficient, fibro from a vestibular injury, fibro from sleep apnea, and genetic fibromyalgia. So when you break it down in that way, it makes it so that, okay, once you know what type of fibro someone has, there's a path forward to healing. So in physical therapy school, my program, and I think many programs across the country, do a good job of emphasizing to us, fibro is not a psychological disorder. It's not all in your head. We learned that it's not well understood and can sometimes be a diagnosis of exclusion. However, there was a lack of clarity about what could be done. It's like, okay, gentle, low-grade exercise was kind of all that we were offered. So in my clinical experience, treating individuals with fibro, I would tell my patient to exercise. He would look at me like I had 5 heads and say, if I do what you're asking me to do, I'd be in bed for 4 days. And I kind of understood, okay, fibro, you're in pain, okay, like, how can I motivate this person to exercise? Well, because of this training, I understand there is a specific mechanism for this pain after exercise related to sleep dysfunction and how there's a lack of actual human growth hormone due to the stress response that can literally cause muscle damage even with mild exercise. So, as a physical therapist, yesterday gave me a whole new approach on how to dose exercise in an individual with fibromyalgia. I was way overdosing. I was asking these people to do way they are capable of, their bodies are capable of, etc. We do know that exercise helps with fibro, but you can't overdo it. So it's this very fine line of figuring out how much can this, maybe it's 2 minutes on a recumbent bike. Maybe it's like less than that to start, and very, very slowly, gradually increasing. So that was a pearl that I took away yesterday as a physical therapist who was like, I have these people with fibro, I'm really trying to help them. I don't know how to. So let's see, what else did I want to talk about? I just want to emphasize, because I know some of my physical therapy cohort might be watching this, and like me, we're probably looking for ways to help these people, and I can't say enough how FSM gives you a whole new way of approaching any type of pain syndrome, but especially fibromyalgia. And then finally, if you are watching this and you're someone who's suffering with fibromyalgia, if you've had it for 2 years, 5 years, 10 years, 20 years, or if you know someone that's been suffering, I just want you to know there is hope for recovering. There are treatment options through FSM and functional medicine that really, truly get to the root cause and fix what's not working and get you out of this cycle of pain. There were 95 people in this fibromyalgia course yesterday. So if you're not in Boulder or near Niwot where I'm practicing, and I would love to help anyone who has fibro, call me. I can do a free 15-minute consult. We can talk about if it's going to work for us to work together. But if you can't see me, go on frequencyspecific.com/ I wrote this down, .com/frequency-specific microcurrent practitioners, or just look for the practitioner locator on the frequency-specific microcurrent website, because there's 95 of us that just took this fibromyalgia workshop, and we all have our certificates to prove it, and we can certainly get you on a path to healing. And then, if you're a medical provider and you really want to help more patients, look into FSM. It totally changed the way I practiced, and I'd be happy to talk to you too, so reach out to me if you have questions. So everybody, today is day 2. I'm going to head into John Starkey's fascia workshop for 8 hours of learning about fascia from the master. So I am so excited, and we'll be tuning in either tonight or tomorrow to give you an update on that. Thanks for tuning in, and we'll see you next time. Be well.